So my name is Claudia Fegan, and I have been with PNHP uh, for 32 years. I joined in the spring of 1989. And what I want to do is talk about the importance of relationship with um, our elected representatives, our officials, our government legislators, and how you establish a relationship with those individuals. We were fortunate enough in the early 2000s to already have an existing relationship with John Conyers, who was a representative from Michigan. John Conyers lived to be the oldest African American, longest serving African American member of Congress. He's known for doggedly introducing legislation and reintroducing it again and again until it's passed. The classic example of that was the making a national holiday of Martin Luther King's birthday. Shortly after Dr. King was assassinated, Representative Conyers introduced the legislation to have his birthday declared a national holiday. And as he was reelected again and again, each session of Congress reintroduced that legislation, each session of Congress gathering more and more publicity, finally until he got a lot of uh, uh, public officials, including Stevie Wonder, to support this effort, and he was, of course, successful. He came up with HR 676, and we should be clear about HR 676. HR 676, which was an improved Medicare for all bill, was introduced by Representative Conyers in 2003, but it was through a relationship that Representative Conyers had with PNHP and Quentin Young. And actually, founders of PNHP, David Himmelstein and Steffi Woolhandler, had an instrumental hand in writing that legislation for Representative Conyers, who had become acquainted with our organization and the things that we fought for, and felt that this was a issue that he wanted to make one of his signature pieces of legislation. And he introduced that piece of legislation over and over again. And although it never did come to fruition, as a matter of fact, it never actually got to the floor of the House for an up or down vote, but it did provide us with something that we could organize around. And it did become known as an improved Medicare for all bill. And he was able to get over 120 co-sponsors for that bill. And it became a litmus test that we could ask people who were running for office if they were supportive of that piece of legislation. What we have to remember in the early 2000s is that people were looking for a change. The number of people who were uninsured in the United States in the early 2000s was almost 50 million people. It was 45 and then 48 million people who were uninsured. And people began to recognize that this was a problem, that that people die as a direct result of not having health insurance. We were able to attribute so many deaths to patients just not having access to health care. And in the United States today, having access to health care requires health insurance. If you're uninsured, you don't, by definition, in many parts of the country, you do not have access to health care. So there were a lot of groups who were supportive of us as not just Physicians for a National Health Program. There were the Nurses United, the NNOC, was one of the groups that recognized that this was an issue. Obviously nurses working on the front line of healthcare became very supportive of this effort. And we all remember Michael Moore's movie Sicko, where he realized that people didn't care so much about folks who didn't have health insurance if they had health insurance. But the premise of Sicko was that people cared more about the fact that even if they had health insurance, they weren't protected. And after we published our study showing that the majority of bankruptcies in the United States were the result of medical illness or a medical debt, Michael Moore made the movie to demonstrate how the majority of people who went bankrupt as a result of medical illness or medical debt, were insured at the time of the precipitating event. In other words, if their debt stemmed from breast cancer, they had insurance at the time they contracted breast cancer. But because of the pernicious ways of the insurance industry in this country, their hard work that they put into denying people care or preventing people from expensive forms of care resulted in bankruptcy for even those who were insured. So it was trading on that. Those elements helped us to build a movement toward improved Medicare for all, as there were more and more highly publicized examples of people who had insurance but weren't able to get the care they needed, or people who lost their insurance because they lost their jobs, and they lost their job because of their illness. The more that we were able to publicize this, the more it began to resonate with members of the public who began to realize that that could be me as well. And it was easier to get organizations that were supportive of social justice issues to be supportive of the notion of improved Medicare for all. At the time that um, we first that Bernie Sanders went to the Senate, I went to Washington and visited with Senator Sanders with Quentin Young in 2007, and we tried to persuade him to introduce a bill into Congress that would be a Senate bill for improved Medicare for all. There had previously been a bill in the Senate that had been sponsored by a representative from the state of Washington. However, it had not been reintroduced, and we wanted Senator Sanders to introduce a new bill into the Senate, a companion bill for H.R. 676. And having just crossed from the House of Representatives to the Senate, Senator Sanders was reluctant to support or to introduce a new bill. He thought that we should try to get a more mainstream Democrat to introduce that legislation in the hope that then he would be willing to sign on to it. However, as a couple of years passed and no one had taken up the mantle of an improved Medicare for all, and so Senator Sanders agreed to introduce H.R. 1384. It was that the momentum for improved Medicare for all was growing at that time, and it seemed that we had to have a bill in both the House and the Senate. The Conyers bill, H.R. 676, was really not a bill in the traditional sense. It was more of a skeletal framework of what we would like to have without a lot of details. And Senator Sanders, in looking for compromise, kept a number of things in his bill, H.R. 1384, that we found problematic, in that it still allowed for means testing. It allowed for the funding of how physicians were reimbursed. We felt ultimately could be problematic, and I actually had the opportunity to discuss that with him. But he felt that it was important to make certain compromises in order to garner more support from his Senate colleagues. So there are the public's knowledge about Medicare for all begins to grow through the 2000s as more and more people are experiencing the economic downturn in 2008. People lost their jobs and therefore lost their health insurance, lost access to health care. And it became more and more common as the gig economy began to grow, and people began doing things like driving for Uber, driving for DoorDash, delivering, doing things that allowed them more autonomy in terms of lifestyle, but were less likely to offer them benefits such as health insurance. And as a result of more and more people were uninsured, people who were of traditional means. So you might be a broker, but an independently employed broker who wouldn't have normal health insurance, as people began to realize the high cost of health insurance. Walmart, which offered health insurance to its full-time employees, but had a larger and larger segment of their employees who were not full-time, who were working 24 or 30 hours a week and not getting the benefit. The other thing that Walmart did as they grew as a company across the country was they required their employees to pay a larger percentage of the health insurance premium. Previously, in the uh, 1960s, 70s, 80s, and 90s, employees paid only 10 or 15% of the insurance premium and were therefore pretty blinded to what the cost of health insurance was in this country. Walmart began expecting their employees to pay 20% or 25% of the insurance premiums. And as a result of this requirement to pay a larger percentage of premium, and also as people tried to pay COBRA and realized how much their health insurance premium, how high the premiums actually were, they were less satisfied with the notion that they would have to pay such a large percentage of their earnings toward health insurance. And they tried to, and then with the passage of Obamacare in 2010, where people were required to have health insurance, um, there were these huge disparities created in health insurance. So you had a policy that could cost you $1,000 or $1,500 a month, and yet that policy, as expensive as it was, would have a deductible of $1,000 or $3,000 or even $5,000. So people would wonder, why were they paying so much for health insurance and yet have this huge deductible? It discouraged people from using care because what they really had was catastrophic care. It would pay for that tens of thousands or hundreds of $1,000s bill without paying, being able to afford the cost of a regular doctor's visit or preventive care. So the Affordable Care Act was affordable in name only because people were required to purchase policies that did not offer them the coverage they needed. People who had policies that had a platinum plan might have only a 10% deductible, and a gold plan might have a 20% deductible, a silver plan with a 30% deductible, and then a bronze plan could have a 40% deductible. So people were being shoehorned into these policies. They would buy the cheapest policy, which would be a bronze plan, and it cost them so much per month, and yet the deductibles were so high they weren't able to utilize it for the care that they needed it. So we began to talk about not just people being uninsured, but people being underinsured. And it was incumbent upon us to educate our legislators about what this meant and the impacts of this, because all members of Congress are insured with what might be called a Cadillac plan. They had really very little recognition of the problems of the policies they were creating. They thought that they were offering people insurance without really offering them coverage that they could use in useful and meaningful ways. So the question becomes, how do you establish a relationship with a legislator that will allow you to be a source of information for them and allow you to help them understand uh, these policies? You have to remember that the legislators, whether they are local state representatives or state senators, or they are federal members of Congress, that none of them grow up reading health policy and having an understanding of the implications of policy. And it's important to first establish a relationship and establish your credibility, and then to be able to become a trusted source for them and useful information about policies that they are being asked to vote on or make decisions about. So I've established relationship with legislators over the year, and it has come in a variety of ways. The important thing is to establish relationships with your specific legislator. Um, Congress members and state legislators are always going to be more responsive to someone who's from their district. And it's important to first establish yourself as a voting member of the district of the legislator that you want to talk to or that you want to speak with. Um, Sometimes I've been fortunate in that I've been invited to speak on a panel and a legislator is there. But there are other ways in which people can meet members of Congress and have a meaningful impact. Certainly, um, with Jan Chakowski, who's a representative of a district that I lived in previously. Was previously district was represented by Sid Yates, but I met her first because she was a patient in our practice, and that became a reliable source of information because legislators will certainly listen to their own physicians, and so establishing that relationship is important. But there's also, and I think this is the key way, is to go and to visit a legislator in their home office when they're home on recess. They're there to meet their constituents, to understand their constituents' needs, and to offer yourself as a valuable resource. I've met Representative Chuy Garcia before he even was before he was a congressperson, he was a member of the county board. Before he was a member of the Cook County board, he was an alderman. And so it's very aldermen are very approachable and very interested in hearing from um, physicians. I would say to you that all elected officials are impressed when physicians come to visit them because they know that physicians are very busy, and when they take time from their daily work of taking care of patients to come visit a legislator, they pay attention. So the easiest way to establish a relationship is to first make an appointment to call up. Now, recognize that when you make an appointment to see a legislator, you may only get to talk to a legislative aide. They may have an aide who actually works on health policy if they're a member of Congress. And talking to that person is important because you can establish a relationship that will give you entry to the legislator themselves. With Representative Garcia, I met him in several different venues. He's although not so much now, but he was previously an active marathon runner. And I encountered him on the running path. My husband, who was always active in politics, would often volunteer to canvass for him. And so I would meet him at campaign events where he was trying to talk to volunteers. And just being ever present after seeing him again and again, he wanted to know who I was and what I was about. And that allowed us to foster a relationship that was mutually beneficial. I could be a source of truth for him, and he gave me the opportunity to speak about things that were important to me. I think that being involved in organizations that try to provide useful education to legislators is very important. But it starts with that first phone call about going to the office and meeting them and saying, "Hey, I'm Dr. Fegan. I'd like to talk to you about this piece of legislation. Are you supportive of it? This is why I think it's important." They're always responsive when you can provide not just facts and figures, not just data, but information about their constituents. If you can talk about how many people are uninsured in the legislator's district, if you can talk about patients who may have been constituents, who may be constituents, and the impact of insurance or not having insurance, and or the difficulty in accessing care, or the struggles of a healthcare provider to deliver care for people who don't have adequate funding, not being able to provide people with the resources they need as a direct result of the failures of the system that we have today, are extremely important and meaningful to legislators. And if a legislator knows that they can reach out to you and that you can provide them with the information, and if that you don't have it immediately available, that you promise that you will get back to them and that you provide it to them in a timely fashion, it makes a dramatic difference, and it solidifies that relationship. Um, Legislators want to be reelected. They want to be able to speak to their constituents. They want to sound informed about an issue. They need someone who can get them up to speed, give them information in a concise format that they can easily recall and come back to. They like facts that are useful, that they can use again and again in their talks, especially if they're running for re-election. They are appreciative of data that will appeal to their constituents, that will make a difference, that will be impactful. They want to know, they want to be, they brought up to speed quickly because they cannot have a broad depth of knowledge about a lot of different things. And yet we expect them to speak on those things. And so while they've never been at the bedside of a patient, if you could talk to them and give them information and then paint a picture for them with a story of a patient of your own, um, I call it putting a face on the facts. If you give them the data and then can paint that picture with a story that illustrates the point that you're trying to make, it will make an impact. It makes a difference for that legislator, and they're forever grateful for that. They will come back to you again and again. So the first thing is to make sure that you can reach a legislator in their home office, where you happen to reside. Making a trip to Washington can be useful, but really that works better when you have established that relationship prior to showing up in Washington at their office in Washington. And going to Washington, you're more likely to speak to a legislative aide as opposed to getting an appointment to speak with the legislator themselves. And at that time, they're going to be wanting very specific information. I want you to support this bill, and this is why I want you to support that bill. But if you become a reliable source of information, if you have show up time and time again, you will develop a relationship that will be meaningful and useful to that legislator. They will know, okay, I have something about health policy. Can I call Dr. Fegan? Can she tell me? Can she update me on this? Being agreeable to speaking with that legislator. They're going to have a rally. Yes, I could join you. I'd be happy to talk about this issue. Um, so providing them with a resource that is reliable, that they can use again and again, will forge a relationship that will be mutually beneficial if we're trying to get an improved Medicare for all. So I hope that this information um, helps you understand some of the details of how we do what we do. I can't think of anything more important than physicians establishing these relationships and providing a voice for our patients who are unable to be heard about the pains they suffer as a result of not having access to health care.